If you've ever wondered what it feels like to breathe through a dirty sock, spend a winter morning in Delhi. The air hangs thick like a grey blanket, so dense you can barely see the building across the street. Street vendors wrap scarves around their faces, children cough their way to school, and the city's 30 million residents wake up to air that's literally toxic. This isn't just bad weather or a passing storm. This is Delhi's smog season, when the air becomes so dangerous that simply breathing outside can shorten your life. Every year between October and February, India's capital transforms into one of the most polluted places on Earth. The air quality index regularly hits numbers that are supposed to be impossible. We're talking about pollution levels that are 20, sometimes 30 times higher than what doctors consider safe. To put that in perspective, breathing Delhi's air during smog season is like smoking 2 packs of cigarettes a day, except you don't get to choose when to quit. But here's what makes this story truly shocking. This isn't some industrial accident or natural disaster that caught everyone off guard. This happens every single year, as predictable as clockwork. The hospitals prepare for the surge of respiratory patients, and yet millions of people have no choice but to keep breathing this toxic soup day after day. I've spent weeks researching what's really happening in Delhi during these deadly months, talking to doctors who see the effects firsthand, environmental scientists who measure the poison in the air, and families who've watched their children develop asthma before they can even walk properly. What I discovered is a perfect storm of factors that create this annual health crisis, and the reality is far more complex and disturbing than most people realize. The numbers alone are staggering. During peak smog season, Delhi's air contains particulate matter so fine it penetrates deep into your lungs and enters your bloodstream. We're talking about particles smaller than the width of a human hair, carrying heavy metals, toxic chemicals, and carcinogens directly into your respiratory system. The concentration of these particles often exceeds 400 micrograms per cubic meter, when the World Health Organization says anything above 15 is dangerous for long-term exposure. What's truly terrifying is how quickly this poison affects the human body. Within hours of exposure, healthy adults start experiencing burning eyes, throat irritation, and difficulty breathing. Children and elderly people face immediate risks of heart attacks, strokes, and severe respiratory distress. Emergency rooms across the city see a 40% spike in admissions during smog season, with patients arriving unable to breathe properly. Dr. Arvind Kumar, one of India's leading lung surgeons, has been documenting what this air does to human tissue for over 2 decades. He's performed thousands of surgeries on Delhi residents, and what he finds inside their lungs looks like something from a horror movie. Black deposits coat the lung tissue of patients who've never smoked a cigarette in their lives. Children as young as 10 years old have lungs that look like those of 60-year-old chain smokers. But the medical crisis is just the tip of the iceberg. The economic impact of Delhi's smog season is absolutely devastating. Schools shut down for weeks at a time because it's too dangerous for children to be outside. Construction projects halt, airports cancel hundreds of flights because pilots literally cannot see the runway, and businesses lose billions of dollars as the city essentially grinds to a halt. The psychological toll might be even worse. Imagine living in a place where you're afraid to let your children play outside for 4 months every year. Families invest thousands of dollars in air purifiers that can barely keep up with the toxic assault. People plan their entire lives around avoiding the outdoors during certain times of day. Some wealthy residents actually leave the city entirely during smog season. But that option doesn't exist for the vast majority of Delhi's population. Is that the smog doesn't affect everyone equally. The wealthy neighborhoods with tree-lined streets and fewer vehicles experience significantly better air quality than the crowded slums where millions of poor families live. Children from low-income families are exposed to pollution levels that are literally off the charts, creating a public health disaster that disproportionately impacts those who can least afford medical treatment. The sources of this toxic cloud are as varied as they are overwhelming. Millions of vehicles clog Delhi's roads every day, many of them older diesel trucks and buses that pump out black smoke. Massive coal-powered plants surrounding the city operate around the clock. Construction dust from countless building projects fills the air, but perhaps the most controversial source comes from outside the city entirely. Every autumn, farmers in the neighboring states of Punjab and Haryana burn millions of acres of crop stubble to clear their fields for the next planting season. These agricultural fires create enormous clouds of smoke that drift directly toward Delhi, combining with the city's existing pollution to create a toxic cocktail that can be seen from space. Satellite images show smoke plumes stretching for hundreds of miles, all converging on one of the world's most densely populated urban areas. The government's response to this annual catastrophe has been a series of desperate, often contradictory measures that feel more like panic than policy. When pollution levels spike beyond what their own monitoring systems can measure, officials scramble to implement emergency protocols. They shut down schools, ban construction activities, and restrict vehicle movement based on license plate numbers. The air quality index hit 999, which is literally the maximum reading on most monitoring devices. The actual pollution levels were probably much higher, but the machines simply couldn't measure them. The Delhi government sprayed water from helicopters onto the city, as if they could wash the poison out of the air. It was a desperate gesture that accomplished nothing except highlighting how helpless authorities feel in the face of this crisis. The political blame game that erupts every smog season is almost as toxic as the air itself. Delhi's government points fingers at neighboring states for the crop burning. Those states blame Delhi's vehicles and industries. The federal government promises new regulations that never seem to materialize. Children are developing permanent lung damage, while politicians argue about whose fault it is. Solutions exist, but they require the kind of long-term thinking and massive investment that political systems struggle to deliver. Countries like China have dramatically reduced their air pollution through strict regulations, massive public transportation investments, and a complete overhaul of their energy systems. But those changes took decades and enormous political will. The technology to clean Delhi's air isn't some futuristic fantasy. Electric vehicles could replace diesel buses and trucks. Natural gas could replace coal in power plants. Modern farming techniques could eliminate the need for crop burning. Solar and wind power could reduce dependence on fossil fuels. Delhi would require re-coordinating efforts across multiple states, restructuring entire industries, and spending hundreds of billions of dollars. Some residents have taken matters into their own hands in ways that reveal just how desperate the situation has become. Wealthy neighborhoods have installed giant air purifiers on street corners, creating small pockets of breathable air. Parents drive their children to school in cars with industrial-grade filtration systems. Some families have built sealed rooms in their homes where they retreat during the worst pollution days, essentially creating bunkers to protect themselves from the air outside. The masks that people wear during smog season tell their own story. Regular surgical masks are completely useless against the microscopic particles that make Delhi's air. Children struggle to play sports while wearing these bulky protective devices. Teachers have to repeat lessons because half their students can't hear properly through their filtration masks. Breathe poison or stop breathing altogether. This isn't just an environmental disaster or a policy failure. This is a test of whether we're willing to let an entire generation of children grow up with damaged lungs. Until we treat clean air as a basic human right rather than a luxury, the grey blanket will keep choking one of the world's greatest cities, one breath at a time.